Great. Well, it's nice to see you all again. Quick show of hands. How many people came to our last advocacy session, which was, just what, about 2 months ago? I recognize a few of you. Great. So I'll start with an introduction and then we'll just kind of get into it. As an introduction, my name is Jake Johnston. Like Allison said, I'm a board member at CCI, but you don't probably care about that. You probably care about two things, which is one, that I kind of do this for a living. I do advocacy and government relations for a living with a primary focus on healthcare. And then number two is that I live with chronic illness and I have tons of family members with chronic illness. And I really feel, I think acutely, what I'm guessing all of you feel as well, which is that, there's a lot of fear and concern about our standing in the policy environment right now and kind of what's going to happen to us. So the purpose of this conversation today is really to try to maybe not explain what's going on because a lot of it's inexplicable, but to try to really level set where we're at today, level set what the impacts are, and then also what we can all do in response. And one of the things that I really wanted to start with, and this is really important, and I hope if you don't hear anything else, like you focus on this. There's two messages I really want to deliver. One is that your voice has a role to play in this fight. And we're going to talk about that directly coming up here. But then number two, I've really been struggling to think about how to approach this conversation with you all today. And I've been struggling because I don't know how to logically explain the consequences of proposals that are on the table. At the same time, to have a heart response doesn't feel like it's appropriate in this context either. And at the same time, I kind of want to fight like hell, right? And like what's the disconnect between, the logic, the emotional response and kind of the activism, right? And like how do we tone and message those three factors that are coming in together? So luckily, one of my favorite bands put out a new album 2 weeks ago, and they have a song on there called Head, Heart, and Hands. And the chorus goes, "We got to get my head right, my heart right, and my hands right." And so we're going to do this. We're going to do this talk today. When I'm going to give you a heart response sometimes, I'm going to give you a head response sometimes, and I'm going to give you a hands response sometimes. And that's how we're going to characterize kind of what's going on. And you're going to maybe get a different tone from me at different takes in today's conversation. So that's my intro. I love seeing where everybody's coming from in the chat today. We are clearly weighted in the Western United States with Washington and California, and that's great. But I love to see all of you dialing in from Chapel Hill and Texas and Michigan and Arizona. And frankly, there's a lot more of the fight that might be winnable or gettable in those states than there are in mine. So I'm really glad to see you all here today. And with that, how we're going to do this today, I've got a very short presentation. We're going to go through some slides and really want to be interrupted at any moment if you have questions about what's going on or if there's things that we can get into. And we're going to spend the majority of today focused on the Medicaid program. That is really where the contemporary fight is and where I think the biggest risk to our community is. And maybe one more by caveat, I am not necessarily a policy expert, but this is, I can go pretty deep into this weird wood. So feel free to ask questions if you have them. Great. All right, everybody buckle up. Here we go. Gonna share a screen now. Everybody see this? Excellent. I can see like 3 of you in my sidebar. So for those 3 of you, thank you for giving me verbal cues or visual cues. We pretty much talked about this already, but the goals for this presentation are pretty simple. We're going to do a follow-up from our last presentation. And the last time we all got together, it was after the election and before we knew what the agenda was. And this time we're learning more and more about the agenda. And so last time we talked about what could happen and what were some of our opportunities to engage in that response and to make sure the chronic illness community had a voice. This time, some of those fights are in front of us and we got to figure out what they mean and how do we respond. So we're gonna do that today. You don't care about me. Okay. I do want to know a little bit more about you all. So I'm going to ask for a quick show of hands on the sidebar. And this really does help me. So number one, how many people, we did this quickly, but there's been a few more people that have joined. How many people attended the last advocacy session? Okay. Those of you who are raising your hand, some of this is going to be familiar, but here we go. Second, how many people get health insurance through their employer? Interesting. Okay. Fascinating. Next question. How many people get it through Medicaid? Okay, keep the hands up for a minute. I really want to get a sense of what our community here looks like as it relates to Medicaid. Okay. And then since we met last time, how many people have signed up with a new advocacy or patient organization? And by sign up, I mean donate, I mean join their email list, I mean kind of anything like that. That's fantastic. Way to go, people. All right. Nice to see we got friends in the fight. Next. How many people since we last talked have contacted a member of Congress or an elected official about any issue? Oh my God, look at all you. Great. All right, way to stand up. If you are comfortable, feel free to type into the chat kind of, what you're doing or what you've done. It's really interesting. Um, and last question, how many people have met in person with an elected official between now and January? Anybody? I don't see any hands. Okay. All right. What's happening right now? Since we last spoke, some of the things that we really feared are actually happening, right? We've got RFK installed as the Secretary of Health and Human Services. We've got Elon Musk kind of running rampshod over the federal budget, and in doing so, really impacting everything from medical research to just staffing federal agencies that are processing things that the community needs. Sorry, okay. But the one thing that we're going to focus on today, because I think it's the most pertinent threat, is what's happening to Medicaid. So again, like we talked about earlier, we're going to focus on Medicaid, and we're going to take a lot of time for Q&A. So jump into the chat if you have questions or what things that you want to say. Okay, head, heart, and hands. So how many people, again, quick show of hands, how many people feel like they understand what's happening with the Medicaid fight right now? Not very many people. Let me jump into it. The Medicaid program. Medicaid program is the largest insurance program in America. It is generally paid for from a majority standpoint by the federal government and then administered by every state. So the Medicaid program is designed for children, low-income people, and the disabled, but that was its original intent. But since that original intent, it has been used as a platform to expand healthcare access in different types of markets and strategies. So, for example, the Affordable Care Act dramatically expanded the Medicaid eligibility pool so that states could opt into that and cover more people under under an insurance program. And here's where it gets a little weird. Every state does it differently. So what the federal Medicaid program does is establishes some guidelines and some payment modalities and some expectations. And then states have the ability to essentially go further than that floor that is established by a federal program. So in the state of Washington, for example, Washington has decided to throw some of its own money in, and the federal government's thrown in a pretty substantial chunk, and they have expanded the Medicaid program so that anybody up to 400% the poverty line has access to the program in the state of Washington. And there's an open enrollment period, but also you're able to enroll in the program for any reason if you get laid off, if you're getting unemployment benefits, and things like that. Other states have not necessarily done that. I don't know the state by state kind of delineation. So please don't ask me, North Carolina, what your state does. But because every state has a floor to meet with the federal program, they do have the ability to go further. And many states, Oregon, California, Washington specifically, have really used that as an opportunity to expand access. And by doing so, reduce the amount of the uninsured population in their states to a single digit number, which is a truly remarkable statistic. So a couple of other things about the Medicaid program. It's a very weird one in the healthcare marketplace because in rural communities, Medicaid pays for the majority of care. But Medicaid does not reimburse hospitals or doctors for the cost that that care is. Pays about between 65 and 75% of that visit or of that facility or of that service. So it's really important for rural hospitals specifically that have a very high Medicaid population to make sure that they've got diverse sources of revenue to come in to maintain those things that are open. But here's the trick, and here's why cutting Medicaid has a disproportionate impact on rural communities. That 70% of their budget that comes out of the Medicaid program establishes a floor for commercial-based services as well. And basically, if Medicaid does not cover something like dental or imaging or a medication or something that's on the formulary, then there is absolutely no incentive whatsoever for the commercial marketplace to do so. The floor for your coverage on your Premera plan or your Blue Cross plan or whatever it is established by the public marketplace in the Medicare and the Medicaid programs. And that's why cuts to Medicaid, if they start saying we're not going to reimburse for X, Y, or Z, or drug B, C, or D, then there is a direct correlation between what will happen for all insurance coverage of those services or in that marketplace. The federal floor that is established by these programs dictates the market for everybody else. And that's why we are so concerned about cuts to the Medicaid program, because it's not just about Medicaid recipients or Medicaid beneficiaries. It's about the overall coverage levels that are available to people for healthcare in this community.
Jake, if I can interrupt you for a second, we had a quick question in the chat here. Wanting to know if this was from a couple minutes ago, so I'm not sure exactly what this is referencing, but does that high coverage for Washington mean that many or most people on SSDI with Medicare would also qualify for Medicaid to fill gaps?
The dual beneficiaries. There have been doctoral theses written on this topic, so I'm not sure if I can address that question in detail. All I can say is that once you're eligible for Medicare, Medicare is your primary insurer at that point, and then Medicaid becomes a supplemental or a secondary payer. So if you are dual eligible, the facility that you go to and the doctor that you go to would prefer to be reimbursed by the Medicare program than the Medicaid program because the reimbursement rates are higher, if that helps. But you do have dual eligibility, which is great. Okay, let's move on. Here we go. So what happened? What was this last week? 2 weeks ago? Recently? 2 weeks ago. Was it last week? Yeah, 2 weeks ago on Friday, the House of Representatives passed a budget resolution. And I think it's really important that we drill down on what this is the head part of the conversation. It's really important that we get right what happened, because there's a lot of characterization out there that we cut Medicaid by some tremendous amount. And that has not yet happened. So what the House did is they passed a budget framework, a resolution. And the purpose of doing that is that it gives guidance to the rest of the committees in Congress on how much money there is to spend and where are the targets that they are looking for. And so the House passed bill basically directed for $2 trillion in federal spending cuts over the next decade. And it made space for $4.5 trillion in new tax cuts. And it agreed to raise the debt ceiling by additional $4 trillion. So the question is, where do those cuts come from? And specifically, they directed the Energy and Commerce Committee to come up with $880 billion worth of cuts. over the next 10 years. Now that is not, if you've listened to a House Republican talk about this bill, they will say two things. They say, number one, that the word Medicaid never appeared in the budget resolution. And they will say, number two, that this is guidance. We are not directing anybody to cut Medicaid. We're just giving overall budget targets that we need to meet. And it's up to the committee to determine what that process will look like. Those are both factually true. But substantively, the Energy and Commerce Committee, if you cut every single program under their purview, except for Medicaid, if you cut everything 100%, that would cover $381 billion over 10 years. So the only way that you can get to $880 billion in cuts is to touch the Medicaid program. The math doesn't math any other way. So we are looking at direction from House leadership to basically come up with consequential cuts to the Medicaid program. Now, these are budget cuts. The other thing that you're hearing from the House in advance of this goal is that there is waste, fraud, and abuse that we will be able to trim out of the program that will help us to achieve these budget savings. And while I am certain there's waste, fraud, and abuse in the Medicaid system, we've actually had a function in the government to look at this over time. And, it's not $880 billion is I think what most experts will say. So we have between now and when they actually build a budget and try to pass it by September 30th of this year to really see what the manifestation of this direction looks like. Are these cuts going to show up in a budget? And if so, are they a cut to services? Are they a cut to the number of participants in the program? Are we going to be kicking people out of the pool? We do not know the answers to those questions yet. So the consequence of cuts are unknown, but the cuts haven't happened yet. But the direction from the chamber is to make these cuts and to make them significant. Questions at this point? This feels like a good stop point. And I do want to really, really be clear that both Dems and Republicans are using this issue as a wedge issue right now. And so it's really important that we have a head response about what is the actual on the ground fact here. So Republicans are again saying that we have not cut Medicaid. And we're not directing that these cuts come from Medicaid. And again, those are factually true, though mathematically not true. Democrats are calling this an $880 billion cut to Medicaid that seems to have been implemented yesterday. And that is also not true. Perhaps going to happen, but it has not yet happened. So again, we're in a place where the direction has been set, but the action has not yet occurred. Just want to be really clear with everybody. So what's happened? This week is Medicaid week if you are a political junkie. So basically, every single member of Congress that I know of is doing Medicaid meetings and Medicaid media and Medicaid impact work out in the state right now. This morning, the two elected Republicans from the state of Washington, Dan Newhouse from the 4th District and Michael Baumgartner from the 5th District, met with hospitals and patient groups in their respective districts. I'm happy to give you a readout on what they said. Senator Cantwell put out a Medicaid impact report and has been touring the state talking about this. Senator Murray's been in Olympia, on the Olympic Peninsula, and in southwestern Washington, meeting with community groups and hospitals and organizations about the impact of this cut. And both parties have decided that this is where we're going to pick the big fight on spending. Republicans are doubling down on the message and that this is part of reining in excess federal spending. And this is the fight that they want, or this is the playing field they want to fight on. And Democrats are eager to have this fight and to see if they can sustain some of their success in terms of healthcare access policy that they've won in the past. We are in the middle of this fight, and we as a chronic illness community are the consequences of this fight. but it is unavoidable at this point in time. Questions?
Jake, perhaps you'll get to this, but let me scroll back up here. There's a question about what folks can do. So I don't know if you want me to hold off on that one.
Yeah, we're going to turn that corner real quick.
Okay. Okay.
Okay. Kind of keeping one eye on the clock here, but we'll move forward on this. So what's next? Hey, what can we do? Questions? Great. I jumped the gun. Interesting. Sarah's got a comment in the chat. Let me read it. Sarah says that the one of the biggest message of our lobby meetings was how this administration is swayed by public opinion, but our legislators need stories, data, and participation to give them the data and ammo to fight these cuts and issues. 100%. Sarah, I'm going to call on you in a minute. So get ready to tell this story. But we're going to talk about that. We're going to talk about how to plug in and why it's important. So I just laid down a pretty doom and gloom scenario for what was happening right now to our community and what the threat was. And I do want to make sure that we focus a little bit on hope. This is not an unusual position for our community to be. If you'll recall, just a few years ago, in fact, it was the first Trump administration, we dealt with 70 votes to remove the Affordable Care Act and to remove protections for people who live with pre-existing conditions to be able to participate in the healthcare marketplace. And the House passed it a couple of times, and the Senate eventually didn't, thanks to John McCain's famous thumbs down performative action. But we won, and we won because people showed up and developed a collective voice and a collective anger on the issue. And it paid off then, and I believe it will pay off again. You are not alone. Some of the biggest groups in America are working on this fight, and not the crazy lefties or the business interests, but actually a lot of different organizations. People like the Farm Bureau, who recognize the role that Medicaid plays in rural America to keep workers safe. People like the Hospital Association, people like labor unions. It's not a monolith and it's not a partisan issue. The question is, how do we provide care to needy communities? We kind of skipped this over, but everybody take a breath. I know it's a big issue. We're going to move past the mental care portion of this and get into the what to do. So what is advocacy, right? It is loosely policy making at all levels of government, but it's also personal advocacy. What do you do in your life to advocate for yourself? And if you live with chronic illness, you are a hero advocate already because you have negotiated with your doctor's office about getting a prior authorization for a script. You have figured out that the one specialist that you need to see doesn't have an opening until 2029, and you have figured out how to get in the door this year. You have figured out what accommodations you need in the workplace or in your community or in your family at Thanksgiving with that one weird uncle. Like you have figured out what you need to do to take care of yourself in this community to thrive. Advocacy at a policy level is that in a larger context. And advocacy is storytelling. Advocacy is being public, it's being out there, and it's talking about your fear and the impact of things on your life. And I want to really create a distinction between policy expertise and policy impacts. Because on policy expertise, I don't know most of you. Maybe you are the world's foremost health insurance expert, and that's great. Welcome to the fight. I'm so glad you're here. But I'm guessing most of you have like a life and a real job or cares or things that have nothing to do with thinking about like the health insurance marketplace and what it means in middle America. And if that's true, what you're an expert on is you. You're an expert on what you rely on to take care of yourself. You're an expert on what you need to to be able to be a thriving member of your society. And that need is there's nobody in the world who can tell that story other than you. From Jake Johnston's standpoint, I need access to the pharmaceutical medicine and the technology devices that I use to stay healthy. And if I don't have that, I can't work. And if I can't work, I'm not a contributing member of the tax-paying class. I need to make sure that I have access to a health insurance program and specialist care for the conditions that I live with that cannot be cured. That's my story. And I don't have to tell my member of Congress that they need to pass a bill number or a particular policy. I need to tell them from my heart, I'm scared about what I'm hearing in the paper right now, and I'm worried that you're not standing up to support me. That's my story. And all of us can do that. So why? Because it's happening, everybody. These Medicaid cuts are on the table, and they're going to happen unless we stand up and fight. We can make these slides available to anybody who needs them, and I don't think I need to go through a message building. I kind of want to get to the who's doing what, and I want to have a Q&A with all of you. So I'm going to quickly roll through these, but again, I cannot emphasize enough. Your story and your role is not necessarily to be the policy expert on the Medicaid program. Your role is to talk about what you need and what you're worried about and what you want for your family. Okay. Again, we can make these tips available later. I kind of feel like I'm blowing through them right now, but that's okay. Let's get to this. This is what you can do. You can be out. I led my introduction today by telling you that I live with chronic illness, which is something that I rarely do. Number one, because I don't remember sometimes. Like, that's just part of who I am. Uh, it's part of how I live my life. But number two, like I wanted to come to you as a policy expert or somebody who had credentials, on being able to talk about these issues in this area. But the reality is that I'm someone who can help in this regard because I understand what I need and I understand broadly what we collectively need. The more you can talk to other people and be visible that you live with chronic illness, it helps. It helps your neighbors know that you're okay or that you are impacted by these decisions. It helps to push back on Facebook when there's crazy stuff going on from a member of your family. You know, you don't have to engage in the policy fights of social media, but it's really, really helpful if people know that you live with challenges. And to the degree that you're comfortable doing that, I would encourage you to live openly with the challenges that are real in your life. We're going to talk about talking to policymakers, and more, we're going to talk about holding them accountable because those are the missing pieces of the advocacy ladder right now. Okay. For those of you who came to the last presentation, you saw this. We build an advocacy ladder. And the reason we do that is that each rung on the ladder is a little bit harder to do, and it has a little bit more impact on doing it. What's really hard to do is to climb multiple rungs of that ladder simultaneously. So one thing that we can do collectively is kind of benchmark where we're at on the ladder. What do we do? What are we comfortable doing? How do we feel? And then make the decision if we can go one more rung. So we're going to walk through this a little bit. First thing, what's the easiest thing you can do? You can sign a petition. You can post something to Blue Sky or to X, or you can post something on social media, right? That takes very low effort on your part, and it also has a very low impact. But if that's where you're at, everything helps. And if you're not doing this right now, this is the first rung on the advocacy ladder. It's creating a larger visibility for the issue. Second, send a form letter, postcard, write an email, make a phone call to the office. It takes a little bit more effort, but it actually has a much bigger impact. And one of the things that people are often surprised by is the impact that letters have and phone calls in an office. So I don't know if you if maybe you read political media, maybe you don't. I don't know, but like after throughout the Doge process in DC and the budget issues and all that, like the phones in the Senate have literally been ringing off the hook to the point where they're at like something like 70 times their normal call volume right now. Um, what they do though is they keep a tally mark at the front desks, of like where are the calls coming in, where are they coming in from, are they, generally pro or con on an issue. And those quantitative or quantitative data are reported kind of up the chain and to the elected official. They want to know what's lighting up the phones and where are people coming in on. So does one phone call make a difference? Probably not. But if you're part of a dozen or 2 dozen or a couple hundred dozen, absolutely. That will absolutely register within the office. Which then we get into writing a personal letter or a letter to the editor of a local publication. It takes a lot more time and effort for you to do this, but the impact is tremendous. If you write a personal letter to a member of Congress, there is a pretty good chance they're going to see it. But more, every letter that comes into an office that is not a form letter or not auto-generated, right, will get a response or should get a response. And the number of letters that need to filter through a congressional office before they actually show up in that end of the week report that every member of Congress gets is shockingly low. It's about 7. If 7 individual letters filter through a member of Congress in a given week, they're gonna get they're gonna read that in their mail report at the end of the week, and that will force them to develop a response to the issue. It will force them to go on the record back to you when they write back to you about this issue, and it creates a foundation for how we engage on these issues. This is the rung that does in whole probably the most amount of work. And I like it because I like to write thank you letters. So I feel like it's an antiquated process that we can teach the children. All right. Oh, so much effort. Oh, but so much impact. Get media coverage about your issue. If you write a letter to the editor or if you can talk to a local reporter, and again, media isn't, CNN or Fox News or something, right? Media is your local neighborhood weekly publication. Right? There's all these like mini media markets, right? That are focusing on like the store openings in your neighborhood or kind of, what's happening at city council that week or things like that. In my neighborhood, it's things like My Shoreline News or, the North Seattle Beacon or things like this, right? There's these publications that people in the community read, but they don't go much farther than that. But members of Congress collect media reports from their district staff. And if they are mentioned in these media reports, believe it or not, these people who generally have a fairly high developed ego and sense of narcissism will find their name in the paper at the end of the week, no matter how small that paper is. Volunteering for a campaign and donating to a candidate, it's really hard to make that recommendation in today's environment, but they both have a really high impact. And if you volunteer for a campaign because you're trying to defeat somebody or because you believe in somebody, that's a really strong relationship to build with that policymaker and the other people that are important to them. Donating is the same way. Regrettably, congressional races cost an infinite amount of dollars today. So I'm not saying that your individual donation makes a big difference, but paying the money to go to a fundraiser and saying, hey, I'm here because I wanted to support your efforts to fight Medicaid cuts. That makes a difference. And last, there is nothing you can do that has a bigger impact than having a face-to-face with a member of Congress. And even better, having a face-to-face in public with a member of Congress. Again, if you are political junkies in any way, shape, or form, one of the dominating themes of the past 7 to 10 days in the political press has been town halls. What's happening, right? Members of Congress are showing up at town halls. They're faced with a lot of questions that they don't want to answer. And that confrontation between avoidant members of Congress and the public who are asking questions that's gold for local media, number one. But number two, it puts members of Congress on record, both from an accountability standpoint and from an opportunity standpoint. It's also the hardest thing to do personally. Very few of us are hardwired in a way that is comfortable to show up at a group event where you don't have control over the agenda and to ask a question in a crowded room that might be confrontational. That's not a skill that everybody has. But if you are one of those special people, please use that skill. It makes a big difference. I just love that. I love that woman. She makes me happy. I don't know. I guess I'd like to play this real quick. I don't know if you can hear this on your speakers or not. This is a very quick, it's about a 2-minute video. This is an example of how it works. So what does it look like to show up to a town hall meeting? And like, why is it so effective? And again, I don't know this woman. I don't know. This came from kind of an advocacy newsletter that I saw, but I don't think it's part of like an organized effort. And this is what it looks like to hold members of Congress accountable. And again, this one was on the Affordable Care Act. It was back from 2019, but I think it's still pretty helpful. Here we go. Allison, I'm looking at you on the screen. If this does not come through on a speaker, I don't know, give me the high sign.
Americans like myself covered those with pre-existing conditions, people who are on their parents' insurance, and again, people like myself who need like guaranteed medication. We need for insurance, and I probably did.
And she's asking only because the court's made declared unconstitutional, and I don't think the court's already declared unconstitutional.
You voted 7 times for repeal.
Yes.
Why? What are you going to do on this?
Well, first of all, I'm going to repeal.
Then you told them. I'm going to state my question. I want you to answer me a person whose life depends on insurance. I would be dead in 60 days and that's without the Affordable Care Act.
Is it because of pre-existing conditions?
Yeah, because of life guarantee medication.
There's no question about keeping, pre-existing conditions in the market. If that's your, if that's your question. And so the Affordable Care Act is all the way, and it's not going to be repealed by Congress. You think it's going to be repealed tomorrow? The last time we voted for repeal was when McCain voted the other way, and there's no chance of repealing it now. Besides, if we pass in the Senate, we'll get to the United States House of Representatives. So what are you worried about?
I asked Senator Grassley yesterday why he voted 7 times to repeal the Affordable Care Act and why he wouldn't come up with proposals that would cover with insurance people like myself with pre-existing conditions. I don't know why that question was so hard to answer. I'm still waiting for the answer from him.
All right, that woman's my hero. Again, I don't know her. Maybe she's not a nice person in real life. But in terms of that video, that was so effective. And what that town hall did, and this is back in 2019, but that got national coverage. And the senator in the video is Senator Charles Grassley from Iowa, who's one of the lead Republicans in the Senate right now and is the chair of the Healthcare Committee. And actually, he's currently president pro tem of the Senate. So this type of work keeps elected officials accountable to their community, and it keeps them on alert when there are policies and votes that they may be asked to take that don't have community support. Generally speaking, politicians like to be responsive to their constituents on both sides of the aisle.
Jake, I had a question here in the
Oh.
chat. Wanted to know, oh, sorry. Pop up here. How can folks find town halls and places to ask questions like that publicly?
Yeah, great question. I've got a slide with some of the resources at the back that we'll get to in just a minute. But the easiest thing to do is to get on the email newsletter list that every member of your delegation has. So visit your senator's page and visit your member of Congress's page and sign up for their newsletter. Number one, it's good to know what they're saying. That's helpful. But number two, they generally announce when they are having open to the public meetings through that mechanism. By the same token, if you're on the socials, follow them on their socials. That's how you will learn quickly kind of what's happening. I see some links being shared in the chat right now. I don't know, some of these are partisan, just so you know. But these are resources that are also trying to track kind of where public meetings are being held and how to get there. I do want to come back to this one more time. Your voice is so important in this fight. And what I want you to think about just for a minute, I want you to think about congressional staff and an elected official who is not a specific name that you like or dislike. But they spend their days meeting with experts and industry people and policy people and reading legislation and dry journals and economic forecasts and things like that. And they take meetings by the dozens every day that are usually in 10 to 15-minute increments. And they are just like chink, 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 chink through the day. It's hard. It's a really weird, hard job. What they don't do during the day is talk to actual human beings who are impacted by the consequences of their policies very often. Because when they do that, it's usually a public communications event. But when you can meet with an elected official or their staff and say, I live with chronic illness, I am concerned that we may be cutting the Medicaid program, and I don't know where you're standing up for us. I'd like to hear from you directly what you're doing. That is an unusual meeting for that member of Congress to have, and it stands out. It stands out because you are a person, you are impacted by the consequences of their actions, and you're coming to them to ask them what they're going to do about it. That is an incredibly powerful and memorable part of their day. Sarah is killing it in the chat here. So is Ellen and Rachel, Rosa, excuse me, and some others. Yeah, one of the things that you can do is, we all have different maybe disease conditions or different kind of issues that we're dealing with, but a lot of those specialty organizations really have an advocacy component, right? These national organizations, the Heart Association, MS Society, arthritis, kind of whatever it is, and really helping understand that their job is to be the policy experts, right? Their job is to say, here are the impacts of these decisions on our specific community. But following those organizations federally and getting on their email newsletters and their advocacy alerts, that's a great way to figure out, like, when should I weigh in and help me figure out what to say. Here are some other ways you can find out who represents you if you don't already know. And again, we can make this slide deck available to anybody who wants it. Just send Allison an email. Whoops, these are some of the organizations federally that are in this fight right now and that you can follow to keep track of. And again, this fifth bullet point here, yeah, patient organizations that deal with your specific condition or the things that you are concerned about are a great resource to add to this mix. And finally, these are three groups that are more engaged right now from an activism standpoint. And I would say that all three of these are a little bit more left of center from a policy standpoint. So just so we're being really clear, but Five Calls, Indivisible, and Families USA, they're doing different things and different organizing tactics and strategies, but I think all of them are being extraordinarily effective in what they do. Five Calls, for those of you who don't know it, is literally that. They provide an unbelievable set of resources on um, different policies. And then they connect you directly to the member of Congress's office, where you get to pick the issues that you want to advocate on. And then you can call those offices and then you get added to this collective total. So through the app, you can see that, like, hey, 1,700 people contacted my member of Congress about Medicaid cuts. And I mean, it's amazing to be a part of that movement. My partner does the Five Calls thing every single day. It takes her about 5 minutes, and she is super motivated by that every single day. Indivisible is more of a national organization that is trying to be a little bit more confrontational in town halls and that strategy. I think they do amazing work, but they definitely have a little bit more of an activist reputation right now, kind of and fighting the administration, I think is their core mission. Families USA has been around since the Affordable Care Act, so late 2000s, and they are a national advocacy organization that focuses really intently on things like Medicaid, Medicare, and healthcare access and affordability. So I like what all three of these groups are doing a lot and would strongly recommend them. If other people know links, I'm not the end of these resources by any means, but please throw them into the chat, as I think you already are. Questions? I've just been blurting for 40 minutes. Anybody have things they want to talk about?
Jake, there was a question quite a while back during your Medicaid piece. Someone wanted to know proactive steps they can take to mitigate risk of losing access to Medicaid. A couple examples they gave were working less hours or making less money. Are you able to speak to that?
Yeah, I can't speak to that. The answer is I don't know. But I can tell you a little bit more. Whatever cuts are made to Medicaid will take effect next year. That's just the way the budget works. And so we don't know if states will supplement cuts that are made at the federal level. Right now, the feds pay about for 70% of the Medicaid program. States pay about 30 on average. It's a little bit different state by state. And so what we don't know is if we make an across the board 15% cut to the Medicaid program, is that number of enrollees, is that type of service? I mean, we just don't know, right? So I don't think there's a strategy you can take necessarily today to put yourself in a more competitive position to be eligible for Medicaid next year. I think there's a whole bunch of if-then statements that we have to understand before we can really answer that question. I'm scared. If you're on Medicaid, I please plug into these resources and plug into resources that are doing more casework on the Medicaid front. I think that would be my response. Also, hospitals are a great resource, believe it or not. Hospitals care a lot about getting paid for the care that they provide, and they have benefits people on staff that can help you navigate the different eligibility requirements that are in there. So maybe making an appointment in 2025 when you may have a problem in January of 26, so you build that relationship early, that might be a strong move to make.
I'll just add to that real quick. I think the person who asked the question is in Colorado. So, Medicaid is run by each state, even though they receive money federally. So, pay attention to what's going on in each of your individual states when it comes to Medicaid.
Yeah, Ashley writes in the chat that big hospitals have financial aid that most people don't know about. That is true. Although Ashley, I would say that if we really are making these kind of cuts to Medicaid, I'm not sure that the value of those funds equals the cuts that may be coming in. So yeah, it's a way to help, but it's not a solution to this problem. And Medicaid disproportionately impacts people in rural communities. And hospitals in rural communities tend to be smaller with smaller pools of resources available. Other questions?
Yeah.
Jennifer's doing it old school. She's like actually raising her hand, which I kind of love. So let's go with that.
Hi. Thank y'all for holding this webinar. And Jake, your explanation about what's going on with Medicaid is the clearest I have heard or read. So I really, really appreciate that. Now, as somebody with a chronic illness, though, that struggles with brain fog and memory issues, hearing that one time is not necessarily going to stick. What I've been struggling with, I have just recently joined a group for disabilities and neurodivergence and allyship for a national science association. And so basically what we've been trying to do is work to, as quickly as possible, provide info to the association's members, trying to explain what is happening, not only with with the disability, chronic illness, neurodiverse communities, and that also, of course, involves the DEIA. And we're able to find a lot of resources regarding like the 5 calls and things to, actually send something that has already been drafted or whatever, like a general thing. But what we're having problems finding and what's overwhelming us is finding like succinct, clear, accurate, and as up to date as possible explanations for these different issues that are occurring. I think a bunch of us in our group and in the association are pretty confident about speaking out, but if we know what we're talking about, you know what I'm saying? Especially, in whether it's making a phone call or trying to speak in person to, your representative.
Yeah.
And knowing that you may have a back or forth, we need the information. And it seems like I can find good things like here or there or whatever, but trying to put those all in one place, it is just taking all of our time. Do
Yeah.
you know places, or are there different websites or other resources that have more succinct explanations of these issues?
Yeah, great question. And frankly, I share your frustration. I think finding a consistent, reliable, reputable source of information is really hard, and not just on this issue, but on many, right? Um, so I'm going to disappoint you by saying no. I actually don't know where this lives. I can tell you where I go, but again, I find it wanting. Kaiser Family Foundation, kff.org, I find to be the best place for data.
Okay.
What is the scope of the Medicaid problem, the healthcare policy? They do a really, really good job, I think, of diving deep and getting accurate, trusted sourced information. Okay. But in terms of like, where's the fight? When do we call? What do we say? Right? Which is, I think, what we're trying to do too. I'm looking honestly for some of these groups like Five Calls and Indivisible and Families USA and labor unions and the Hospital Association and like, other groups that are kind of in it, right?
Mhm.
And you got to know where their motivations are.
Right.
Hospitals are in it to make sure they've got a payer for their services. Um, and that's okay when our interests align.
Right.
Yeah, again, Sarah's killing it in the chat. Yeah, this is fantastic. So Sarah, my question back to you, feel free to put it in the chat or jump onto the Zoom as you see fit here. But my personal opinion is that it's really good at key times, but smaller disease organizations have a hard time keeping it current. And like sometimes it's hard to activate a community quickly. And I'm curious what your thoughts are on that.
I think you're so right, especially with, as we've seen with the disability community, right? They just, to be able to get that access when virtual meetings are not um, the norm anymore as they were during the pandemic, which did allow for much more access for different disabled advocates. It is easier to be able to find these bigger organizations that do have lobby days that can get you in the room with your, I will say, generally when I've had meetings with RDLA through their Rare Disease Week and lobby days, we've been given 30 minutes with staffers and even with the senator or representative meeting with us in person many times. And they will take time, even if they don't know about your issue, they want to be educated about it so that they can take that back. And for example, Representative Adam Smith had been my representative before we just got redistricted last year or the year before. And he was on the intelligence committee and said he knew nothing, but we found out we shared a hip surgeon in common, and he could understand and relate to how that connected to having many joint surgeries for my Ehlers-Danlos syndrome, and was, I think, a huge part of why EDS got added to the Department of Defense's congressionally directed medical research program. And that's a huge funding contributor. What I will say is from other lobbyists and healthcare policy people I've heard in DC is that this administration is hoping to move a lot of research and a lot of medical healthcare stuff into the Department of Defense. And so it's going to be very interesting to see what exactly gets moved over, what the language is that they use with that. But the great thing is I have never seen a more busy, in the 10 years of going to DC for Rare Disease Week, I've never had a more busy week seeing scientists, teachers, all sorts of constituents just sharing their stories. And if you make meetings, they want to get that time with you because your story, and remember, you don't have to be an expert in policy, as you've said, you have a PhD. It's called Personal History of Disease. And you've lived that experience, whatever that is. And it can be through your insurance issues or maybe through your support group shared issues and say, this is something of my community. It doesn't necessarily have to be personalized, or you don't have to share more information than is necessary for it to make that impact for them to go, whoa, you have how many people in your support group? Or whoa, how many people can't make it to your support group or can't make it to the doctor? And it's really heartening to know that they are really fighting on our behalf. But the more involved that we are and the more civically engaged we can be, the more ammunition that gives them to be able to fight the good fight and to be able to say, look at how many of my constituents are suffering with this. This is not okay. It gives them the ability to get angry, even though they're trying. And the best thing about this is that we have to remain bipartisan. And I remembered that when I met Representative Baumgartner just a few weeks ago, he's taking over for Kathy McMorris Rogers, who was a rare disease champion. And I come in with no assumptions and just say, you're filling the shoes of an amazing rare disease champion, and I can't wait to see what you're doing. I'd love to educate you about my disease. And we all went around the room and did. And we got a really great feedback from his staffers saying, we want to join the Rare Disease Caucus. We want to know more about legislation and policy and coverage issues. And so it really is important, whether it's that phone call or email or meeting in person, especially. RDLA does not only Rare Disease Week, but this summer you can sign up for their lobby day in district here in Washington and meet with your legislators here in their Washington state offices. So there's a 2-time-a-year opportunity, and other organizations are trying to set up similar lobby days. So take every opportunity you can. They're out there, and we need every diverse voice and every experience reflected in these stories.
Sarah, I mean, on behalf of all of us, I mean, thank you so much for flying to DC and having these meetings and doing it for 10 years. Like, thank you so much. It is such an important story. And I look forward to you leading the next one of these advocacy presentations so I can just pepper you with questions from the audience. That's my intent.
I would love that. And no, thank you so much for this webinar, because it really is awesome to just see all of us on here and know that we're all really engaged and want to do everything we can. And I think, you know, what I've learned from the last Trump administration, he was actually the first president to ever use the words rare disease. Um, and I will always give him credit for that. And it's important to remember that he could be easily swayed with stories. And when he starts to get exposed to those stories and people, then sometimes the rhetoric changes and the policy starts to change. And so it is important. It's so important to be engaged, and all of you being here gives me such hope and joy that everybody is so involved and can share their unique perspectives and will really have such a huge impact that way.
That's great. Randy, I see you've got your hand.
Yes, yes. Thank you. And thank you so much for this. It was very informative and I appreciate it. And I'm very encouraged. My question is, well, I'm one that is very disgusted with the state of politics. So I just tend to turn my head, but I still like to be proactive. I am a science-based person and I do want to engage rather quickly. But as you've pointed out, you've given a lot of resources. It can be a little overwhelming. And I am one that will be happy to debate facts, but I have to feel comfortable knowing those facts. But I am stepping into a round 2 of an illness that isn't thought well by the current administration, and we'll probably get cuts with it. But if I jump in and use some of those canned letters, do you feel like those canned letters fall flat? Because a lot of times when if you're interviewing people and you get the generic cover letter and you've seen the same one 5 times because they printed it from the same website, or if you just see a canned letter, sometimes it goes flat. But do you really think it makes an impact if I wanted to jump in and help as quickly as I can with doing what I can until I find groups that I can join and help in a deeper way?
Yeah, Brandy, you just absolutely described the advocacy ladder. And the idea is that we all kind of benchmark what we're doing right now, right? And the idea is not to go from doing nothing to being Sarah Tompkins, right? The idea is to do one thing more. And so benchmark where you're at and just take it one rung up. And so if one rung up for you, given where you're at in your life and what's going on, is joining a form letter or joining something that's easy or doing something that is low impact but is more than you're doing now, my goodness, we need you. And if all of us go one rung up, it's collectively really, really powerful. Those form letters, you're right, they don't make a difference by themselves. I don't want to lie to you, but they get tabulated and tallied. And if 1,000 signatures go on that letter, the member of Congress is going to get it at the end of the week and be like, oh my God, 1,000 people signed this petition on X. I guess we better figure out what we're telling people about it, right? I mean, like that's the actual inside the office response. I worked on the Hill in a congressional office for about 10 years. And there is a hierarchy of how do you contact an office, right?
Yeah, and I'll be happy to do that, and I'll be happy to preach that rather than getting a generic sympathy card. If they ask me what they can do for me, I'll be happy to spread. Let's move it forward and move on to the next step and save some benefits.
Yeah. Other questions? I know we're a little bit over time. I 2 more comments real quick if you'll indulge me. Number 1, I really appreciate all of you. I appreciate you showing up on a Thursday. I appreciate you spending your lunch hour Pacific Coast time with us to kind of talk about some of these issues. And more, I really, really appreciate whatever you can do to help. Go one rung on that ladder. It makes a huge difference. It really does. And I really appreciate you specifically for whatever you can do. And second is one of the things that you can do is look to the groups that are doing the work and help. CCI is in a really cool place right now, right? Where we are trying to do more bringing people together and like talk about some of these issues. And we're evaluating if this is a function that we can invest in, but we don't have the resources to do that. So if you've got an extra $10 a month kicking around, please kick it to Allison and tell her to do more advocacy. You know, like these groups, like in, you know, if you're doing 5 calls or whatever it is, like throw a couple of dollars at these organizations that are keeping you informed and doing the work. None of this work is free, but it requires all of us to make it happen. Also, Allison, I'll be sending you $10 for advocacy.
Thank you, Jake. And just to give a quick plug for our support groups, you know, it's a great place to connect with other like-minded folks who are dealing with a lot of the same challenges and fears that all of you are. So, you know, feel free to check them out. We've got 20 plus support groups that happen each month, and a couple of our amazing facilitators are with us today. So yeah, check them out. I will send out an email with Jake's slides, the link to the video recording from today, and I'll try to input all the links that people shared as well. I'm going to try to save the chat here.
All right. Go get them, everybody.
Thank you for joining us, everybody. We appreciate it.
Thank you.
Thanks, Jake. Thank you all.
You can probably turn off the recording, Allison.